On this morning's Health Watch, we're starting our new series, Allergy Alert. If you're sneezing and coughing, is it a cold or is it an allergy? Dr. Jonathan Fields is director of the Pediatric Allergy Clinic at New York University Medical Center. Good morning, doctor.
Good morning.
So let's talk about the symptoms that colds and allergies have in common. In both cases, you'll have runny, stuffy nose, sore throat, and watery eyes. Are there any symptoms that are unique to allergies?
Certainly. Itching usually implies allergy. With a cold, you normally don't itch.
Itchy nose, itchy ears.
Ears, very sensitive sign of allergies.
All right, let's talk about clues as to whether you have a cold or an allergy. If you have a fever, is it a cold or an allergy?
Fever tend to imply more of a cold. Allergies, even though we call it hay fever, you rarely have fever.
If you have symptoms that kind of develop over time versus come on all at once, what are you more likely to have?
More likely a cold.
All right, so with an allergy, you will see them do what?
Acute onset, very severe sneezing, itching, usually not the slow onset of a virus or a cold.
What about duration? How long does a cold last? How long do allergies last?
I always say a cold lasts, a week if you treat it, 7 days if you don't, typically a week. Longer symptoms imply allergies, weeks or even months.
All right, next clue. You've been sick for more than 2 weeks. Well, you just answered that one. You probably have allergies.
Absolutely.
All right. Lastly, if you're sick in March, do you have a cold? I can probably guess this one.
You can probably guess that with the pollen and the trees, absolutely.
So what about treatments? What do you recommend? What are these, for example?
These work for either. These aren't even medicines. These are simple devices that rinse out the nose and sinuses and get rid of the pollen if it's an allergy, or a bacteria or virus if it's a cold. It's a safe, simple, before you go to any medicines, way to treat allergies or a cold.
Oh, that's a great tip. So flush out your nose either way.
Either way.
And be prepared to stick with it if it's an allergy.
Absolutely.
All right, thank you so much.
My pleasure, thank you.
Thank you, doctor. Coming up in tomorrow's Allergy Alert, a survival guide for springtime allergy sufferers. To take a quiz about preventing the common cold, just head to our website, earlyshow.cbsnews.com.